All right, everybody. Thank you so much for joining tonight on our talk about our something we're very proud about, our IHE signature system on how to treat and actually prevent knee surgeries, how to improve people's knee pain, how to again help people's knee arthritis, and so forth. So we have a signature knee program of care and very excited that I've been able to develop that here with my team. And I'm looking forward to giving everybody a lot more information about this here tonight. This is being recorded. So if you don't want yourself on video, then of course you can keep your cameras off. We will be accepting questions as they come along. So if you want to put them into the chat, you can absolutely do that and we'll try to answer them. Otherwise, certainly by the end, we will answer those questions. And at the end, if anybody wants to actually pop on and ask any questions one-on-one, we can do that as well. So let's talk about our signature knee program of care. We want obviously lasting relief, and that's what me, obviously Dr. Vikas Puri, I'm the president and co-founder of Intelligent Health Group, but my wife, Dr. Bajaj, and I have been on a mission to try and bring more innovative technology to solve orthopedic problems, musculoskeletal problems, problems that affect people on an everyday basis. So obviously, as chiropractors, we definitely deal with neck pain and back pain, which is such commonplace. Obviously, next month is all about World Spine Day. Spinal problems is the theme, and it's so common. 80% of the people get back pain at some point in their life. But I'm sure the knee is not far behind. Knee problems are just so common. And I think obviously knee replacement surgeries have become very commonplace as well. I think again, there's various reasons for that, and we'll talk about that. But the main thing is if we can actually do things to manage the condition, to slow progression down, that's what we want to do. And that's what we try to strive for here at Intelligent Health Group. So we've been dealing with chronic pain issues. I mean, me myself, certainly over the last 25 to 30 years, I've been working on, trying to treat patients with chronic issues, chronic pain. And the knee is something that I've become very fascinated with and have tried to really come up with a solution. And now we're having some great results with that through our new program. Um, Intelligent Health Group, then, it's all about not just leveraging the newest technologies, but also a multidisciplinary approach. So not just chiropractors, but physiotherapists, acupuncture, so forth. We all come together with the same vision and mission to make people happier and healthier. So it's a very patient-centered approach. It's a very, our whole hope is that we provide compassion, provide solutions for people. We want to be leaders in the field. So for the purposes of this talk, I'm going to specifically focus in on knee arthritis to keep it simple because obviously there's various types of knee problems. There's meniscus problems where the cartilage in between the knee joint can tear. It can get inflamed. You obviously get strains and sprains of the knee. All of those things can be helped as well through our knee programming. But very specifically, the thing that we focus on is knee arthritis because again, it's so commonplace, and our whole program is really built at solving that issue specifically. So, how does it work? Well, let's first talk about what is knee arthritis first before we talk about solutions. So, with knee arthritis, the cartilage in between the knee joints starts to break down. Our bones start to remodel. Okay. And inflammation begins. So the bones come closer together, you start getting inflammation of the knee joint. Okay. And that leads to pain, stiffness, lack of mobility. Here's a great image to describe that. Okay. What's happening. So on the far left, you'll see that this is a fairly normal to minimally degenerated knee. It's only 10% of cartilage loss. Cartilage is this white stuff in between the bones. This is your cushioning between the bones. So it looks fairly good. Um, the second phase, so you start seeing here, there's cracks in the second picture. So that's when degeneration starts to progress. That now at this point it's called mild osteoarthritic change or degenerative joint disease. In the second phase here, which is called moderate arthritis, you get multiple cracks there in the cartilage, and you can see that the bone under the cartilage starts to remodel itself. You start getting cracks in the bones. And the very last phase is where it's bone on bone, and there's tremendous degeneration, deterioration of the cartilage. So those are different stages of arthritis. If we look on an X-ray, and when you come to our clinics and we assess you, we send you for X-rays, and we take a look at seeing, what the knees look like. So we ideally want to see this picture on the left. So the top part of this picture is your femur. That's your upper thigh bone, okay? And then you have your lower bone, which is called your tibia. That is your calf bone, okay? So where the two bones come together, that forms a joint. So joints are like hinges. It's where the two bones come together. That's a joint. So this is the knee joint. There should be, again, a space between the bones. And again, that would be that white stuff I talked about, the cartilage. That would be the spacer. Think of it like brake pads in the car. Like that's the little padding there in between. Now, with arthritis, what happens, as shown previously, is that the cartilage starts to break down. And you can see here on the right, the bones are almost fusing together. See that? How the bone is kind of like literally merging with the level below. They're like literally fusing. That you can imagine is bone on bone, very, very painful. And traditionally, an orthopedic surgeon looking at that would say, you need surgery. There's pretty much no cartilage left. What we need to do is we need to cut the top part off, the bottom part off, and put some metal implants in here and try to create an artificial knee. Okay. Again, there'll be a whole bunch of rehab after that to try and get some mobility back and to get you starting to move fairly normally again. It is a pretty routine surgery. There are complications that can happen, but it is becoming more commonplace. But certainly, people have experienced things like allergies or failed surgeries, or they have to redo it again, or they can just never regain their full mobility. So, obviously, if we can maintain the material, like our natural bones and our joints to the greatest extent possible, that's obviously the ultimate goal. But at some point, it's possible that you can't do anything without actually getting the surgery. And we would let you know that too when you came here for a consultation. So we showed you an X-ray. Here again on the right side, you see another X-ray version kind of showing where the bones are coming together. But in real time, as you may have seen on yourselves or people with arthritis, you can see that the knee actually starts to get swollen with swelling and inflammation. So you see this person's right knee here, it's quite swollen and it looks bigger than the other side. And that's because when you get arthritis, you get things called bone spurs. If you look here on the left side in this pictorial, it says here bone spurs. There's extra bone formation at the tips and edges of the bone, and the bone starts to change shape. And that's why the knees start to look bigger uh, alongside the swelling, which also makes it look more enlarged. So here, that white stuff, the cartilage, you can see there's breaks, there's tears, there's holes. It's almost like tearing of a film. That's what's happening there when you get degenerative changes. So painful condition. So now that you kind of have a general impression of what arthritis is, what degenerative changes look like, the bones are coming closer together, we gotta think, what's the solution? How do we treat this? And traditionally, obviously, if you go to a physiotherapist previously, they would do manual therapy. They may do some manual traction of the knee. They may try to obviously do ice or heat, do things to just manage the symptoms. And then show you exercises, but that was about it. It may cause us some degree of relief, but nothing really long lasting or significant. Now, we are very excited because we have now launched our Neon Track system. So we're one of only a couple of clinics in all of Canada right now that have the Neon Track technology through ErgoFlex. It is fantastic. It is specifically a non-invasive, non-surgical way of actually opening up the joint space again, bringing fluid back into that knee joint, taking pressure off the cartilage, allowing the area to heal, certainly reducing inflammation. This is tremendous, and this is way better than manually trying to pull somebody's knee. This is very specific. It really opens it up. Go to as much as 30 pounds of pressure, so you really get a nice gapping of that joint. We obviously, when you first come in, don't use 30 pounds. We incrementally add the weight from 15 pounds and work our way up to 30 pounds over time. And the amount of traction we do, and the amount of times where we open up the joint and then close the joint and create more of a pumping action for that joint, it changes as we go along. We kind of progress along the way until you get much more of a intermittent traction for really, really increasing mobility, getting really good results there. And that's second part of our protocol. Um, Obviously, if you've just recently had a tear, or you have ligament injuries, you have meniscus problems that just started, or if you have cancers, infections, certain things, certainly a break in the bone, we wouldn't be doing that at this point. But when things are more chronic, then we can begin. So that's what decompression is. Now, it'll be great for me to show you a quick video on this so you get an idea. This is what the technology looks like. Okay. Here's a nice illustration. So this is the machine you sit on, you get strapped in, and the knee joint starts to separate. And again, to varying intensities as we go along, we start to create that gapping of the joint. Open and close, just like that. And as we open and close, create the pumping, you can see the fluids, minerals can get back in and start to hydrate this cartilage that is starting to dry up, that's starting to decay, and it can get nourished again. It can start to replenish itself. So that's the image there, which gives you a good idea of what it would be doing inside the body. Okay. So what do we find with knee decompression? So if we x-ray you, say a certain time period later, you will see that this happens. See that there was very little light getting through before on the inside of the knee joint. The outside of the knee joint here is big, but the inside is closed down. We often see that. If you are going to get knee arthritis, it starts on the insides of your knees. So the inside of your knee is where you get degeneration first. Because usually we start getting flat-footed as we age, and then we get more pressure on our inside of our knee. So there's very little light getting through here. But if after the decompression treatment, you see that the space is opened up, you get a lot more light going through. And now all of a sudden, where it seemed like it was bone on bone, it's not. And all of a sudden your surgeon is saying, hey, you actually don't need surgery. So that's the beauty of it. That's the exciting thing with decompression. Now, this is now our own recipe. On their own, these are different technologies and they have things they can help with. Certainly knee decompression specifically is for people with knee problems, like knee arthritis. But now what I've done is I've leveraged other technologies that can help to optimize the results even further. And this is where things get really exciting and we make it our own recipe here. And so we use our class 4 laser technology at the same time as the knee decompression is going on. So while the knee joint is getting distracted and opened up, we use this machine here. You can see the laser light. 4 wavelengths of healing light between 810 to 980 nanometers. They're very high power, high intensity. They go into the tissue, right into the cartilage there, and they start to heal those tears. Remember those breaks we saw in the cartilage? It starts to repair that, almost like a soldering. The cracks start to come together. Inflammation starts to come down. Certainly a great deal more blood flow gets into the area. And we put the body into a fast forward mode of natural healing. Really starts to repair the tissue. This is fantastic. So already naturally minerals were getting into the joint through the traction, but now by stimulating more blood flow into the area, and with this very, very healing light to the tissue, you get even better results. Now, again, the only contraindications here are obviously if you had a tattoo there, because ink absorbs that light very quickly and then you can get some more burning action, or if you have cancers, We just do it for safety, but otherwise, very, very safe. It has no side effects. You don't feel anything except some warmth. And that's the beauty of our class 4 laser. So that those two things on their own together will start giving you tremendous results for your knee. No matter what the problem, if it's a meniscus problem, if it's a tear in the meniscus, or again, if you have degenerative changes, it will definitely show great results. Now, obviously, I'm a chiropractor. At Intelligent Health Group, you see our logo at the top. Our spine is in the center of our logo because we are chiropractic specific. We understand the chiropractic philosophy that if the spine and the nervous system is well adjusted and it's well working, the master control system of the body, then your healing potential is going to go up. If your spinal system isn't functioning properly, you just won't heal with the same level of uh, ability. So, subluxations, which is a result of stress buildup in the body over time, makes the nervous system not work as well. Joints start to stiffen up, reduced nerve flow goes out to the body. So very important that the people are well adjusted, that the spine is well adjusted. You have good flexibility in that spine. There's good nerve flow from the spine out to the limbs, like the knee. The other thing that happens is when we do chiropractic adjustments, we decrease stress in the body. A very specific signal goes from the joint that we're adjusting to the brain to turn down stress-producing hormone. And then that will mean less inflammation in the body. So getting chiropractic adjustments is good for the whole body, but certainly when you have inflammatory issues like arthritis, it will tremendously help bring down inflammation. It will definitely speed up the natural healing processes. So we include chiropractic as part of our knee program. It's definitely something that we want to make sure is not getting missed. It's another little part of the ingredient. So again, as you can see, we're starting to make more of a wholesome, holistic solution here with our recipe. We want to make sure we have all those seasonings that are going to help make this the best outcome possible. Obviously, traditionally, people go to physiotherapists when they have problems like extremities, like knee problems. They're doing exercises for them. They're doing stretches and then strengthening. They're telling them what exercises to do at home. We will definitely include that in our program as well. So whether it's working with our physiotherapists themselves or maybe a clinical assistant, a physiotherapist assistant, or a kinesiologist, somebody is going to be doing active therapy instruction with you. They may be doing some things there on site with you, or certainly giving you those recommendations and instructions for home, but certainly guiding and supervising that process of initially getting you more flexible in your knee, and then later in the later part of the program, doing more of a strengthening and stabilization format for those exercises. And that's the approach. So our program is 12 weeks long. Okay, it's a 3-month program. It's 24 treatments that we do over 90 days. And so the first month is all about pain management, all about reducing pain, getting more flexibility in. The second part of care, from weeks 5 to 12, is where we ramp things up to do more strengthening and stabilization, okay, when it comes to the active exercises. Now, this is a tool, a technology that we just brought in this year. I'm, again, extremely excited about this because we use horizontal therapy for so many other conditions as well. We actually can use it for any pain issues, fibromyalgia, autoimmune issues. We use it there's even a prevention, a wellness thing for helping you with sleep. But we use it specifically for our neuropathy programs to regenerate nerves. And yes, certainly for osteoarthritis when it comes to the knee. This technology called horizontal therapy is a new, very new type of bioelectric stimulation. Now, when you go to physio, you've probably already seen like an IFC machine or a TENS machine, or a TENS machine you use at home, like those Dr. Hose machines. Those machines have a specific frequency and their purpose is pain relief only. And so they have a very specific impulse. It's a bit of a harsh impulse, but it works. And its point is to distract the brain and then have less pain signals going to the brain. So that works at 250 hertz. To give you an example of the amount of hertz this machine uses, it uses over 12,000 hertz. So, significantly more, like about 200 times more. But it doesn't mean that's more intense to the body. It just means that it's a different frequency of electricity. And when there's this much frequency, it actually goes right into the deeper tissues. It doesn't hit the skin. It actually penetrates right through. It seeps right in and goes right deep. So it's good for nerve repair, tissue repair, and so forth. There's been studies done now, and the specific study I have here is beautiful. This research shows that people that were using horizontal therapy, that that remodeling of the bone that happens, I showed you before, starts to change. It also showed that synovial fluid, the natural fluid inside the knee joint, starts to regenerate when you're using this technology. So it has been really recognized for having great results specifically with the knee. So if we do this for 20 to 30 minutes, and we usually do this after the knee decompression is done, we lie you down in a comfortable place. You can relax for a while for 20, 30 minutes, and we put this electric stimulation on. And unless you have, like, pacemaker, you're pregnant, or you have certain metal implants, um, those would be the only contraindications. We can safely do this. And the great thing with this frequency, as I mentioned, because it goes in the deeper tissue, it doesn't hit the skin, you don't really feel anything. You actually don't even really know anything is on. Maybe you feel a mild stimulation, and that's about it. So very, very gentle. Again, no side effects from it, aside from these contraindications. So again, a very safe way of creating even more optimization of the end result. So we had the class 4 laser improving circulation into the area, speeding up natural healing of the tissues. The bioelectric stimulation works at the cellular level, right there in the cell. It works, and it helps to, again, repair nerve functioning, enhancing cartilage formation, specifically that fluid production from the cells in the knee. And on its own, because of all these things, it's helping with pain management too. Certainly, you've heard of glucosamine supplements. We always recommend people with arthritis take glucosamine. That's the natural building block of cartilage. So when that becomes weak and low, you want to be supplementing with it. Just like if you had osteoporosis, you want to supplement with calcium. So we recommend this product. You may already be using it. It's called Genicol. You can get from the local health food store, such as Healthy Planet. And yeah, if you go to Healthy Planet, you get 10% off when you tell them you're a patient or a client of Intelligent Health Group. So Genicol is great. It's specifically for the knee. Again, Gena means knee, but it has glucosamine in it. It has a bunch of other things too, like turmeric and so forth. And it's really, really good at creating better cartilage health. And it will improve your mobility and so forth as well. So we recommend taking that too during the course of our program. Okay. So we've told you about our treatment. I'm going to now go right into, again, our program, kind of what it looks like for you from the moment you come in till the end, what the patient journey sort of looks like. And again, I know people have been joining us and coming on and off. I just want you to know as well, very excited. You want to stay till the end because we have an amazing offer for you at the end, specifically a very special exclusive discount to you for our program. So if you want to take advantage of that, do stay till the end because it's only found here tonight. So the patient journey. If you haven't been a client of ours already, then I'll let you know that for whatever condition you may have, when you come to an Intelligent Health Group location, we have the same signature system. We bring you in, we do a very thorough assessment, examination. For the knees, we would obviously check the whole spine, but we would check that knee specific. We would do orthopedic testing. We would make sure there's no nerve issues. We do some neurological testing as needed. We would send you for those x-rays so we can understand the level of degeneration you may or may not have. Okay. And then what we do is we would have you come back. We do a report of findings. Okay. The report of findings is where we'll tell you exactly what's going on, how long it's going to take for you to get to certain levels of improvement, what kind of treatments are going to happen, what the treatments involve, the pros and cons of every treatment, and then certainly the costing of the program. We go through all of that during our report of findings. When we start talking about the knee program, we would educate you obviously on all the machines as mentioned, as well as any other modifications you can make in your lifestyle, such as at work or ergonomic changes to make sure there's less stress on your knees. We'll discuss that, discuss the home exercises and so forth. Okay. So once the treatment plan begins, as mentioned, we have those two parts of the treatment, right? Phase one and phase two. So phase one would be all the treatments I've showed you before. And phase two would be the same treatments, just that what we're trying to accomplish, the results of those treatments then is different. There are more functional changes happening in the second half of the program. You start moving more, you start more mobility gets better. Again, we're working at this point on more strengthening and stabilization of the condition. So you get more lasting changes once you go through that second part of care. The first half is great, you get pain relief. If you want things to last and stick, then continuing on until things are more stable, and that second phase is the key. So again, this whole program would be 24 sessions, 12 sessions for phase one, 12 for phase two. Our progress exams. We definitely want to make sure things are getting better. So the definition of insanity, I always say, is doing the same thing over and over and expecting a different result. We don't do that here. If we're not seeing improvement, we definitely change course. We change course very quickly, but if need be, if things are kind of running under the radar and we can't pick things up, we certainly pick them up at the progress exam. We do a very thorough exam, almost like we did on day one, and really, really evaluate the changes in mobility, strength, pain, and so forth. And we make sure you're on track. Otherwise, we modify the programming at that point. Same thing at the end of the program, we'll do a final assessment, make sure things are good. If things are stable, then we can move you to what we call a maintenance program, or you can consider as a phase three, and we can tell you what that would involve to make sure, again, things just don't come back, and any stress and strain that is building on the knee, we keep cleaning that up. That's more like oil changes at that point. There's no more repairs. The car is fixed. It's just now your regular tune-ups. So let's go into the price. I know everyone always thinks, okay, well, what's the price of this? Well, first of all, let me tell you the great value of the program. The actual value of the program is high, but what we provided to our patients for is very small in relation to what we could charge and what things would be charged at if you did each of these treatments independently and didn't do as part of a program or this big overall holistic recipe that we've packaged together for you. So each individual thing that I mentioned, like whether it's the horizontal therapy or our class 4 lasers or knee decompression, those are all considered advanced rehab technologies. Every time you come and do an advanced modality in any of our centers, you're paying $100 a session. So for example, somebody comes and they have a bad elbow, and I'm just doing a laser treatment for them to help speed up the healing of the elbow, that's $100. If somebody comes and they're just, saying, okay, I just want one session of knee decompression, I just want to try that out, that's just $100 just for that machine. Same thing with the horizontal therapy, 30 minutes. Somebody says, I want to use this for whether it's pain management or just to stimulate some healing. I'm just doing it as a one-off, that's $100. Our chiropractic adjustments in office are $70, and of course, our progress exams are $35 each. So the actual program value would be $89.50. But not to worry, that's not what we sell our knee decompression program for. At Intelligent Health Group, we try to make things very accessible for people. We don't want any barriers. So we try to really lower the cost down so that you can take advantage. Because before, what we were finding is when we didn't do this, people would say, well, I maybe can't afford this. Just give me this part. Or, you know what's the most important thing in this program? I'll just maybe pay for that. Maybe I'll just pay for the knee decompression program. Or maybe, in my situation, I'm just going to do the laser. And what happened was people get degrees of relief, but for us, we don't see people get the same results clearly as if they did everything. If they did everything, they get the maximum optimal result, the best result possible. And I didn't want to cheat anyone out of that opportunity. I want that for everybody. It's really important for me. And so for that reason, what we said is, we know people can afford about $150 a session. People pay that for an extended physio session. Let's just do that. Let's just let people pay $150 a session if they want and take advantage of the program. So if you do that, along with our progress exams, the overall program would only cost you $36.70. So unlike the $89.50, it's, I mean, significantly discounted, 60-70% discount to $36.70. So that would be the cost of the program. Now, most people in our office, they like to take advantage of the retainer option. You can actually enroll in this program as a package. If you're doing a packaged program, then the cost actually comes down to just 3,000 even. So that is a one-time payment clearly, but it's a retainer. It's not that you're stuck in a program. If things aren't working or you want to stop, you just get back what's left on the account, the part that's been unused, that's still on the credit on the account, you just take it back. So it's fully refunded, okay, what's left on the account. So don't worry about that part. But the good thing about being on a retainer with a one-time retainer and taking this on as a package is that you get that discounted price and you get a whole bunch of bonuses. One bonus that we're giving right now is everybody coming in will also get a free session with our holistic practitioner. So if you don't know about Selena Mitra, she is amazing. She's a hypnotist. She does a lot of biofeedback. She does a lot of energy medicine. But what she does is she will help you with managing your pain just through modulating your emotions, through biofeedback, through visualization. And what we have found is when you can actually be equipped with that and know how to do that and take care of your pains by putting your mind in a very positive space and visualizing and almost directing your body to heal, again, you get even more optimal results. So that will be included in the program, no extra charge. Okay, that one session with her where she breaks that down, maybe gives you a recording that you can listen to at home each day will be there as part of the program as well. So that's one bonus. But also, if there's any other devices you need, say that we feel like you need knee braces as well for support. Again, those things are covered by insurance. We'll get to that in a second. Or if there's things that are not covered by insurance that you want to take advantage of, again, products are 10% off on the uninsured items when you're in a retained package program with us. Also, you get the guarantee. The guarantee is that if there's no changes in your condition and you've done everything we've said for this program, we'll keep treating you for free or 45 days, whatever comes first. Okay. So that's again our guarantee to you for being in this program with us. So lots of good benefits of taking this on as a package. Okay. Now, in conclusion, then, if you start to look at this, aside from the holistic practitioner that I told you I'll plug in, just looking again at the core programming, the knee decompression treatments, the class 4 laser therapy to really accelerate your healing, the active rehab portion, the exercises, all your chiropractic adjustments. And yes, you know, the beauty of this is that even though you're paying $3,000 for the program, for example, if you're doing that, you get your chiropractic treatments included. So if you're already coming for chiropractic treatment, all of a sudden now you don't have to pay for that separate. It's already included. So that's another way of saving money. You're pretty much are getting your full spinal care because we're not just going to be adjusting your knee. We're going to be adjusting the whole spine and the knee. So you'll get all your chiropractic treatments included as part of this program. So it's a huge savings. Again, your horizontal therapy, your genical supplementation, okay? Doing this, you will get less pain, better mobility, long-term knee stability, and the best thing is less drugs or no drugs, and certainly avoiding surgery. That's the beauty of the program. So here is a special offer I want to give everybody now at the end of our webinar tonight, and then I will open it up for questions. So we've already seen that the package program is as low as $3,000. Now today, just for today, for the people here on this call, what I want to do is provide even a further discount. So this is a bit crazy because this I don't even think is seriously covers our costs through the 12 weeks for all that we do. But Again, I'm excited because we've developed this. I want more people to have access to this. So for two people, the first two people that are able to take their phones out and scan this QR code will get the whole program for $2,700. So for 2,700, you'll have the full program. So a significant savings. Again, the regular value would be as much as 89.50. You're getting for 2,700. And there you get tremendous results with this. So first two people that do that will get that. The way this works again, you would take out your phones, you would scan the QR code, and a message will come up. If it says that the window is closed, then that means you already have two people that have signed up. If it shows that you can actually purchase it, then there's a secure link through Stripe. So it's secure, encrypted. Everything is safe in there, and you can actually pay for the program, at which point our administrators will reach out to you and get you booked in to get you started. The cost here includes all your initial examination, all the diagnostics, all that is also included. This is an all-inclusive program. Okay. Again, you see our providers there doing that act of the laser and the knee decompression at the same time. And that is what you can expect. So our desire for you, our hope for you is that you take control of your health. If you're still unsure, or if you're not sure about, how this will help you specifically or your condition, or you want more of a consultation, I'm happy to book a free consultation with you. You can absolutely just reach out to our clinic and have them book an appointment with me specifically uh, via phone. I can do a phone consultation, or you can come into our clinic itself. I'm happy to meet with you in person, and we can discuss everything and see if you would be a good fit, if you would qualify for our programming. Okay. So we don't want knee pain to control your life. It's time that you take control of it and find a solution for yourself. So our clinic number is there. You can certainly call our clinic number. Where is the knee decompression located? So right now, we are there in Brampton and Mississauga. So our head office location in Mississauga has the knee decompression program. And literally just this last week, we've now started at our Brickyard location, our flagship location, where we've been serving people the last 23 years. It has our knee decompression technology there too, as well as everything else. So the whole programming now can be done through our Brampton location. So you have both locations available to you. So click on the location closest to you to book in your appointment. All right. So with that, I am now going to stop the screen share and be open to answering any questions you have. So if you have any questions, you can let me know. You can certainly put it in the chat, or if it's easier for you, you can unmute yourself and ask me your questions. All right, so I'm going to first of all just take a few questions here that were written down, and I'll answer those. And again, there is a place where here on Zoom where you can actually raise your hand. If you raise
Hi,
your
sorry. Oh, I was just gonna ask where I could raise my hand. I usually use micro Teams.
Yeah, we have a place to raise hand. It's basically would be there under um at the bottom. But did you have a question since I have you on right
Yes,
now?
my question just was about the booking the free the consultation.
Yep.
So I just sorry, you were saying I just called the clinic and just ask for you personally.
Yeah, and what I'm going to do here is I can actually do this as well. In the chat, if you want, I can also just put in my direct email address. You can always send me an email. That's my email address there in the chat. You can email me, but you can also, like I said, call the office. So Mississauga's extension 5 and our Brampton location's extension 2. And but my direct line is extension 0. So if you actually call that number and dial extension 0, you'll get me. Okay. Or you can leave a message for me if it's my voicemail, and then I'll get back to you. Okay. So either email or text me, and I can arrange with my staff to call you and get you booked in for a free consultation. Does that answer your
Okay.
question?
Yes, thank you. Sorry about that. My baby, she's with me. She just started crying.
Oh, no worries. Beautiful.
Hello, can you hear me, Dr. Vikas?
Yes, Roy.
Okay. Listen, I got some issue with my knee, both is my knee, and I went and I took the what they call the PRP. I,
Beautiful.
yeah, and you know what? To my surprise, I've been told that this is gonna work really good for me. I took all three of the treatment, but I still leave with the same back the way I started. And I'm not too sure now you have this program. And pardon me if I'm going a little bit too harsh here, because one of the things is like the new technology, I'm willing to try it, but I did not get any result. But I missed part of your program in the beginning, so I'm not fully, I get a little bit longer time to sign in. So this new program, is there this been proven and it's been like say, well, a lot of people get relief with it. There is a scale from 1 to like 100 or 50% people get relief with it.
So I would say that because everyone's condition is different, the beauty of it so far, we've been using in our Mississauga location this technology now, pretty much for the last close to 1 year now. I think it's been 11 months that we've been doing the programming. I will say that it has been shocking for me. Of all our treatments, this has provided the greatest results in the quickest amount of time for any condition that we treat. So people, even after 1 or 2 sessions with this program, they're starting to see pain relief. People that were hobbling before, walking in with canes, walkers, they're walking now. So that's the type of results I've seen. Now, that doesn't mean that everyone's going to translate that way. Clearly, everyone's condition's different, everyone's age is different. Obviously, once we assess you, we would tell you what we would expect from your specific condition and let you know what's possible. But yes, I would say I don't know anybody so far over the last 11 months that didn't get relief from it to some degree or other. So I'm very proud of that. Again, I'm sure at some point we'll get somebody maybe that won't respond for whatever reason, but no, it's definitely been proven over this last year to have tremendous results in the majority of the people.
Well, this PRP, which I really believe because it took my blood, and which is spun it, centrifugal, and they install it, I mean, inject it back, and which I thought that this will be able to regenerate some of the, the fluid and the bone able to help. But that's where I get a little bit, disbelief in in that kind of program. I thought that may be better. So what's the difference in this in your one, the one that you're
Well, they're totally two different things, right? So the beauty of it is in the US,
mm,
my counterparts in the US, they actually do the PRP as part of this program, the program that I do. So I'm just going to again share my screen because I don't know at what point you came on, but if you look at the beginning part of our presentation, um, this is the bone on bone that's happening with people on the right side here. And so the thing is, if you inject PRP into the joint, there's not much space in that joint for the PRP to go. Now, you'll get some material going in there. PRP is obviously not as strong as stem cells, but
right.
stem cell therapy is not allowed in Canada. If you go to the US, they would actually inject you with stem cells, which would be even better.
Mhm.
But you'll get some PRP getting in there, some plasma getting in there. They're like baby stem cells, and you may get some changes. But because everything is closed up in here, you're not getting as much result. Now, if you actually do the knee decompression treatment, look what happens. Where it's bone on bone or the bones are coming close together, you get a big gap in the joint. A nice, beautiful gapping of the joint happens after your treatments. And so our counterparts in the US, while the knee is in decompression mode, they're injecting the PRP at that time. So the PRP is injected under decompression. And then people in the US are getting better results from their PRP treatment. Here in Canada, they're not doing that.
I think that's what my when they have done that, there was no decompression. So that could be one
Exactly.
I think may be true.
Exactly.
There was no decompression. When I ask about it, it says no, I don't have to worry about it. The liquid will get in there. But
It gets
that's
in
not,
there, but it just won't get there in there enough as much. Clearly, you can see that, you inject something in here, you get some, but if it's open and your fluid's going in there and it's not getting compressed again, you'll get better results. Now, other than that, when we use the class 4 laser, this light goes into the cells. So they would go literally into the platelet cells. So
right.
PRP is platelet rich plasma. So the laser light would go into the platelets and would actually start to reproduce those platelets. This actually puts the cells into fast forward mode of healing. They go into rapid regenerative mode. So they start to replicate very quickly under this laser light. And so if you did PRP and under decompression and then you had this laser done, you would get significantly more proliferation of platelets and better results from the cartilage regeneration. But again, they don't do that. Again, my counterparts in the US do that,
Mhm.
but we don't have that here because chiropractors are not allowed to do PRP here in this country, but in the US we are, and so we have all this, right? So where I trained out of Texas, and when I trained there, all my colleagues are using PRP as part of the program. The only thing my program doesn't include is the PRP. But the beauty with you, Roy, is that you've had PRP now. Now, how long ago did you have it done? Was it within the last 6 months?
Last year, I believe it was in last year. That would be March. But one of the thing is, I'm still active. My two knees, but the only thing I can bend, I can do squat, I play golf. But what I found out that I'm getting, it's becoming a little bit more worse than what it was before. And when I ask about it, that listen, if I can continue with my activities, I've been told yes. So I went after that, when the pain started to become a little bit more worse, and I took an X-ray. I went to see one of the knee surgeon, and he's a very good friend of mine. And he looked at it and he says, "Look, Roy, you don't need because it's not bone to bone. That what you need to do is to build some more muscles and try to strengthen it." And that's where I'm doing what I'm doing. And when I look up, because I catch a later part in your program, maybe I should take the Genical and maybe work
Yeah.
a little bit and strengthen it. This is where I'm at, but I still continue to play golf. But I'm very curious. Like, I don't want to go and you can appreciate where I'm coming from. I don't want to go and throw more money into something that, just like an experimental kind of stage. See what if it will work for me, I will work for somebody else.
Well, the beauty of it is that it's not experimental. We've been doing it over the last year, as I mentioned, and my counterparts in the US have been doing it for even longer.
Mm,
So this definitely works. We have great success with it. The other thing is, if you caught what I said at the end, if you take our package programming, the discounted price,
mm,
and if you ever want to stop, say you want to stop, 4 visits in, 5 visits in, or whatever, I would recommend you wait till our progress exam at the 12th visit. But if at any point you want to stop, you just get back what's left on your account, right? You're not stuck into anything. It's just a retainer. We bill it off at $150 per visit, and then you can cash it out at any time, whatever's left on
Oh,
your account. So
so,
you're not so really there's no obligation,
mhm.
and you will see for yourself. You're not going to just be wasting money for the sake of it. We wouldn't let that happen.
Well, I'm not saying that what it will be, but I'm curious, and I really want to get a little bit more fluidity in my knee and my performance because I kind of enjoy golf, but the only thing that I cannot do it because I get some restriction and something. I'm not too sure whether if I got a torn meniscus, would you able to determine that if I come there and visit to say whether if I get a torn meniscus or something like that?
Now, have you had any diagnostic imaging done? Have you had an MRI or an ultrasound done?
No, I only took just the X-ray.
Okay, well, absolutely. When you come to our office, as I mentioned at the beginning part of my presentation, we have a very thorough exam process. So we would do the orthopedic testing required. We would determine if there's potentially a meniscus issue or if it's something else or if it's just degenerative changes. Obviously, we consent for x-rays as well, but if we feel like you need an MRI or an ultrasound, we'll let you know and we'll help you get that arranged. But we want to be fully sure before we start anything that we know exactly what's going on. We wouldn't really start any programming until we know exactly for sure what's happening. And once we do, then we'll actually put the customized program together for you and start out. So with us, you never have to worry about wasting time
Right.
or money. Like I said, you could even just pay per visit, $150 a visit, and you'll start seeing the results yourself. But the first part is let's get you assessed, figure it out, and then start you on your way.
Yeah,
If you
I
had the PRP within 6 months
yeah,
and we were doing this, we could have still leveraged some of the PRP effect, but it's been too long.
yeah,
So we would just do our program now. So far, my patients have not needed the PRP. I've had two patients that did PRP recently or at the same time and were doing it, and they got great results. But most of our patients don't get PRP, and they get great results with our programming. So that's what I can tell you.
okay, two quick question. Number one, um, let's say I make the down payment now 2,700 or 3,000. Let's say what you don't bill that right away, right? You take that in an increment for the
That's exactly it. It's a retainer. It's just a credit on account. So if you've ever had a lawyer and you put a retainer down, it just is the amount that we think it's going to cost for this part of our program.
I
And
got that.
so the $2,700 is just a credit on account. That's all it is. And
Mhm.
then once you come to our office, every time you come, we bill $150 off of that
I
each and
got
every time. And if at any point you say, okay, I want to stop, whatever that credit still is left, you just get that back. It's as
okay,
simple as
got it.
that.
The other question quickly. I would like to come first to get an assessment to know what's really is going on there with my knee,
For
and
sure.
you can able to would you able to determine to say, look, you know what, are you the proper candidate, or you are not, or you get a issue? I would able to be told at that time when I come for the first assessment.
Yeah, absolutely. That's our process. First would be the assessment,
Hmm.
and then the second time you come, we would do something called a report of findings. And then I would tell you, yes, exactly what's going on, how we can help, what kind of results we think we can get with you. And of course, again, tell everybody the costing, but you guys know the costing now.
Right.
So all of that will be presented. And once we're clear and you say, yes, let's go, then we begin treatment right away after that. So that's how the process will go.
You know what? I think I might give it a try again because I'm
No,
very
it's worth it because you have nothing to lose,
no, no, I know.
literally, about getting the opinion, especially because it sounds like you're very active, you like to golf, etc. Bad knees are not good companions with golf, I'll tell you that right now. So we want to keep you active. It's really important that we keep you active. We prevent surgeries, we prevent any needless drugs. It's good to get a wholesome solution. This is a wholesome solution. This is the best conservative solution in the market. You
Mhm.
cannot get that anywhere else, except again if you went to the US and you got the PRP included with this, that would be the only thing. But
Right.
otherwise, here in Canada, this is the very best thing you can possibly do for this and with good results. So I definitely urge you, at least come in, get assessed. There's no obligation with the assessment. What I can offer you right now, what I'm doing for just regular patients is for any condition, is a $49 offer. So for
Okay.
$49, you can come in, you can get the full assessment done,
Right.
and we'll work you up. And I'll even give you that first treatment complimentary as part of that $49. That's a promotion we have for people just experiencing everything. So that one I'll just reserve ahead of time for you. Then after that, you can decide if you want to enter our program.
You know, I will definitely take you up on that because I'm very optimistic, and I don't want my knee to be like right now where it is. It's functioning at a very good level, but then I'm getting some pain, so I don't want any further degeneration. If I can get that that treatment and I can able to progress from that, that will be like an amen for me, like a good thing for me. So I'll definitely take you up on that one, and I'll. How do I book the appointment? Just call the number and book the appointment.
Yeah, what city are you in?
I'm in Brampton.
Okay, perfect. And like I said, we're very excited that we launched that in Brampton last week. So
Mm.
the full programming is there. That's my flagship location for the last 23 years. So you just basically dial the number that's there in the chat,
And should I
press
make
extension 2, and they'll take you to our Brickyard location. We're at Williams Parkway and Highway 10,
mm,
and they will book you in for the initial promo. And I'll send them a message after this that Roy Pile is going to be calling in and to give you that offer I just told you.
that will be really appreciative. I will certainly take you up on this.
Okay,
Like
beautiful,
I
Roy.
said, I'm a very optimistic and I'm willing to try, but I just don't want to because I got that failure. I don't mean to repeat myself, but I kind of have that little bit of a bad taste in my mouth with the PRP. And then afterward, I did some research and then found out they should have been do that a compression, like kind of a decompression, then let the liquid go in there. I'm not too sure, but then I found out that that would have been the better choice. But anyway, look,
Well, it would have been, but they don't do that.
yeah,
Orthopedic
no,
surgeons are not doing that.
that's true.
So that's why I'm saying that you wouldn't be able to have gotten that anyway. But with
Yeah.
us, you're getting that decompression and you're getting the technology to help build back the synovial fluid in there. And the regenerative effects of the cells with the laser. So it's a really good program and you're definitely going to get results. Like I have no doubt you're going to get results. Now,
Yeah,
if you have any reports with you, then bring them in with you. Otherwise, we'll take it from there. Okay?
I do not have any report. I can get a report from one of the orthopedic surgeon. I can have a report if you won't need be, but you can always, get it from him too, or
Yeah,
I,
absolutely. We'll work on that when you come in.
or I have. I really appreciate it, Doc, and I'm looking forward to come there, Doc, to have that visit with you.
Okay, wonderful. Looking
Thank you
forward
very
to it.
much. It's an awesome program. I think this I should try to share with a lot of my friends, many people who have this knee surgeon. I will just pass it on. I
I
get
appreciate that.
PRP, but nobody takes me up on it.
Well, let's spread the good word, right? It's about saving people, about helping people. Again, like I said in the beginning of my conversation, which you may have missed, we
Yeah,
just want to make people happier and healthier. I mean, that's what we're here for. We've made this very accessible for people. This normally, like I said, is a value of $8,950, this program. And on for people on today, I've made it 2,700. I mean, it's insane, but I just want people to get relief. I don't like to see people with knee problems. And I know with the market the way it is today, money is tight. So we're going to make it successful for people. The other thing is, just so people know, we do have financing in-house as well through our MetaCard program. If you do qualify for financing, you can actually pay off the program in small monthly installments. That's always an option as well. So again, money's not really an issue. The real issue, like Roy is saying, he should see results. And I know that we can get results. And if you're in a package program, we have the guarantee. The guarantee is if you don't get better, we keep treating you for free or 45 days. Again, it's on us to make sure we move the needle, and we will.
all right.
Okay, Roy?
Great. Thanks very much. I really appreciate it.
Absolutely.
Okay.
All right, Alejandra, um, you can ask your question. And
Hi,
hopefully your
thank
speech is
you.
okay.
Yes, I figured it out now. So I just want to ask, are you only located in Brampton? I didn't get to hear you too well before.
We have 5 locations.
No, no, I've been to the Brantford location. I'm aware of that. I'm asking if you personally are only work in Brampton.
Well, me myself, I'm practicing
Yes.
currently in Mississauga in our head office.
Oh, that's great. Okay. I there is a doctor I would go to see in Brantford for chiropract. She was working under Ginny, Dr. Ginny, but she's now full-time in Mississauga. I don't remember her name. She's a chiropractor. She's really, really great.
That's my wife, Dr.
Oh,
Badesi.
really? Oh, I honestly, she's amazing. That's why I'm
She's the best we
decided.
got.
Yeah, so I was even hoping to book an appointment with her soon too, because I haven't been in chiropractic. But
Absolutely. Yeah, yeah. She's here in our Mississauga location and our Brampton location. She practiced at both locations. So if you ever want to come and visit with her, and you can certainly call in and she'd be happy to go over that and this program with you as well. Now, do you live in Brantford? Is that where you are?
no, I live in Hamilton, but
Well, you're not far from us, within 30 minutes of us. So that would be
yeah,
good.
that's why I don't mind going down to Mississauga, but I was just gonna ask, could you also let your staff know that would I will be calling in as well to book an appointment for the assessment?
Let me just take a note. And do you have knee problems? Is that your issue as well?
Yes, yes. I do. I'm currently doing physio, like hands-on physio, but this program just I don't know. It just your wife actually was the one who did my initial assessment.
Beautiful.
So I guess you guys would have my files and everything.
Yeah, we'll pull that from the Brantford location. So Alejandra Gueva, right? Okay, Gueva. Perfect. Sounds
Okay.
good.
Thank
And
you.
again, you can always email me as well. And again, for our Mississauga location, it's extension number 5, but you can also reach me at extension 0.
Okay, perfect. Thank you so much.
No worries. All right. Do we have any other questions from the others on with us? Okay. So if not, there was a couple of questions here previously, as well as from some of the other platforms here joining us right now. One of them is from LinkedIn. One of the people there is a doctor, and they're just asking about the long-term effects of the program. So, I mean, this is a great question, right? So, as I mentioned earlier, everything that we do, we'll need some degree of maintenance afterwards, but the main fix-up will be done. So wherever we can actually improve your functioning through that second phase of care that we talked about by strengthening and stabilizing the area, you definitely will be functioning at a different level. Like right now you're here, then you're going to be here, then we're going to be able to maintain it, okay? By telling you what simple things to do at home, and maybe periodic visits with us just to make sure that you don't lose any of the effects that we've done. Unfortunately, we don't live in bubbles, you know. Sometimes we wish we did, but obviously there's stressors on our body every single day. We're taking steps every single day. If you have arthritis, please understand we're not reversing arthritis, we're improving upon it. We're helping the symptoms of it. We certainly are slowing this down, possibly even halting arthritic changes, but we know you can't be normal again. So with that, you'll always have some degree of maintenance we have to do. There's a weak link there. So lifting properly, changing your ergonomics, how you do things, making sure you have the right footwear, certain assisted devices, whether it's even bracing, etc. We'll plug those things in to make sure you get good lasting results. But certainly, as you saw from the images I showed you before and after pictures of x-rays, that joint really opens up and you're in a far better place. It is like putting you into reverse. It's like a little time travel and you make yourself go back in time and get to a little bit of a better place. So um, you definitely have more longevity now and you're going to last longer. You're going to push surgery away farther into the future. So I'm quite excited about that, very pleased, and I'm sure you will be as well. So that was a great question. I think the other questions that came through, we've already answered. Um, Yeah, in terms of supplements and diet, so we talked about the Genicol. I really like that product. It's a fantastic product. But other than that, other food, just generally speaking, whenever you have an inflammatory condition or any healing needed in the body, you want to make sure your body's as alkaline as possible. So alkaline means that our blood has different acidity levels or pH levels. You ideally do not want to be in the acidic range, you want to be more in the alkaline range, because that's where inflammation comes down. If your blood's not acidic, then you're going to be less inflamed. So that's why we say if you really need healing, if you really want to take it hard and take it to that next level, then yeah, eating clean, drinking lots of water, hydrating yourself, lots of greens, fresh greens, that would be fantastic. If that's difficult, even those green powders that you can get from the health food store, that would be fantastic. They're wonderful. So just lean meats, vegetables, lots of water. That's called an anti-inflammatory diet. So no processed foods, sugars, red meats, kind of take those out of the diet as much as possible, and you have an anti-inflammatory diet. So that's what I would say would be to optimize. Again, I don't think that's essential for this part, but yeah, anything you can do to help continually to optimize. Again, it's a little more seasonings to the recipe here. I think that would be good. Okay, there's a question about the holistic practitioner. Yes, it is one session, but with that one session, which he'll be gifting you if you do take our program today, is a recording. And that recording is like a visualization, a meditation that you can do every day. And through biofeedback, by just that visualization, you'll be putting your body in a much better place of healing. Stress will come down. You'll be directing your body, the body's mechanics to go into healing, to begin the healing process. You'll be directing your healing. And we know when the mind and body is more connected that way, you get way better results. And they've tested that in two double-blind studies. People that don't do visualization and biofeedback versus the ones that do, and it definitely has better results if you can actually incorporate this. So that will be included as part of our programming. Okay. Um, so hopefully that answers that question. And that is not a hypnosis session. It is again a visualization, an affirmation. So that's what you're going to be getting. All right. So any last questions before we close off? All right. So I'm going to pull it up one last time then for us, for people that maybe joined us late as well. So there is our QR code. Okay. There's our offer for the day. Again, scan that, have it on hand. Again, no obligation. By signing up, you're just reserving a spot. We don't start billing off of that. Once you come in, we begin program. If we feel like you're not a good fit for the program, you'll just get back your money right away. That's fine, but this at least reserves this discounted price. But otherwise, that's okay. You can always come in and pay the 150 each time, or our regular pricing of just the 3,000 flat if you decide to do a package at a later time. Okay, or if you're not one of these first two people. All right, so let's keep that up. You can take your picture if you haven't already. And if anybody wants a copy of this presentation afterwards to review, then just please do send me an email. Again, my email's in the chat, and we can always send you this as well as the replay of the recording. So thank you for joining us tonight. It is our passion and mission to give, love, and serve all of you. Please don't hesitate to reach out. I'll be happy to jump on a call with anybody to discuss any issue you're having, whether it's knees or anything else. Let's get you some relief. Let's make you happier and healthier. That's what it's about. All right. Well, have a great evening, everybody. Thank you for joining.